I'm Eric Kirshner. I'm the Internal Medicine Program Director. I am in charge of trying to establish a curriculum for our residents, making sure that they get the education they need to be excellent doctors, because I'm an old guy and they'll need to take care of me someday. I want to make sure that they have a good experience here and basically help shepherd them and guide them through the entire program. We're looking for the person that has not only the intelligence to graduate medical school and be a great doctor, but also an excellent person as well. We're looking for somebody who can fit into our St. Rita's medical community and the Lima community in general, which is really a very friendly community. Unlike a lot of older established programs that have been set in stone and are immutable because they do things the way they've always done things, we're a younger, very dynamic program, and while we do have a clear goal in mind and a very clear set of curriculum projects in place, here residents can actually take an active role in designing their own pathway a little bit. And so we're looking for people that are willing to actually play a role in their own career development and outcomes.
A few factors went into this decision of this. Mostly was the breadth and scope of the cases we see here. Despite having this hometown feel to this hospital, it does cover quite a few counties, and you get to see a lot of different pathologies come through. So it was really interesting from that perspective, and I felt that it would be best for my education if I got to see more of those in my training. This is a program where you do have the support backing you, but ultimately it's up to you to start making decisions and start being a leader as you would expect to be if you were a doctor practicing out in the field right now. Lima is very hometown, so if you've ever watched movies in the past where it's like, oh, this hometown, everyone knows each other by name, it's very much like that. And there's a lot of great people here. The residents especially are very easy to get along with, and it's just a great time having them here. I would really like to shout out to Dr. Kirshner and Deb Miller on this as well too, because no matter what questions you have, they're there to answer them, and they answer them in a very timely fashion. If you feel that something's amiss or something's not going well, you can always bring questions or problems to their attention, and they're more than willing to sit down with you and work out solutions to the problems at hand.
I get to know them a little bit. I talk to them about their family, where they live, how close they have family to where they're at now, just to make sure they're not feeling alone. I talk to them about what's going well with their rotation and what is not, and if there's things that aren't going so well, we try and work on getting that corrected. Somebody with passion, somebody that's very passionate about why they really went into being a physician, that they want to help people. To me, that's very important. Also taking time with them, not just quickly run in a room and run out, but they have that passion to sit and talk with them, get to know their patients.
My name is Dr. Raj Palajla. I am an internal medicine resident here at St. Rita's Medical Center. My experience has been amazing. Everyone is very open arms here in terms of the residents getting involved with a lot of leadership opportunities. We have a lot of councils, including graduate medical education, a lot of the wellness activities here, and there's a whole plethora of different activities that residents can be a part of. You know, things that they have strengths in, and things that they really feel proud to be a part of. And I feel like it's not just being a part of it as well, just for the sake of it. You have a lot of say in a lot of things that happen here, and that leadership opportunity was really, really unique here, and I think that's a great way to really bolster your career and start your career. We're treated just like an attending physician that's fully trained and certified. You're really incorporated in a lot of what we do here at St. Rita's. You're involved in a lot of procedures, you're involved in a lot of decision making for the patient, and you're a real good advocate for the patient here. You won't really get to have this type of interaction, this type of responsibility in any other program that I saw.
More than anything, what I look for is someone I can work well with. I don't expect people to be completed projects when they get here. My job is to teach residents how to be complete doctors. As long as I have someone who's going to work well with others, who's excited and wants to learn, who's prepared to put in a lot of work, because residency is a lot of work, those are the people we've been lucky enough to get so far. So. The biggest thing is making sure that we have those interpersonal relationships, keeping open lines of communication. Communication is everything kind of keeps coming back to. It's what we need to learn to do, not just for ourselves and our own well-being, but for our patients' well-being too. So, the better we can be as communicators, the better we're going to be as physicians. So, it starts with taking care of ourselves in that regard. I work with the residents on a very regular basis, and I encourage a lot of feedback. I've tried to make sure they know nothing is off limits. Everything needs to be out in the open, that problems only get fixed if everyone is aware that they are a problem.
So my name is Dr. Farivar. I'm a resident in the internal medicine program at St. Rita's Medical Center. So I generally get to St. Rita's in the morning around 6:45. I start pre-rounding on my own patients that I've been following up with, and then around 7 o'clock I will meet with my attending. My attending will assign me to new patients that have been recently admitted, and at that point I'll go and start charting on those new patients and looking up everything that I need to get familiarized with their case. I generally look forward to seeing whether therapies of yesterday have improved, made a difference in patients that I'm following. And I also look forward to getting feedback from my attendings and having them teach me anything that I didn't know.
We have an amazingly active ICU. It's really a fairly state-of-the-art ICU. We remodeled it really not that many years ago. We do advanced ventilatory modes that even many academic centers that I've been at don't do. We are starting to do extracorporeal membrane oxygenation, which is done at only a handful of hospitals around the country. We do bedside dialysis, bedside plasmapheresis, therapeutic plasma exchange, advanced diagnostics, cardiac intervention, neurointervention. These are interventions you would typically associate with a large academic university medical center, yet because of the dedication and the mission-driven nature of the people that run our hospital and our hospital system, they felt it was important to bring those advanced medical care capabilities to the rural population in this region, and they've very effectively done that. We went to a much more, I think, functional multidisciplinary bedside rounding. We took those people and made them active participants in daily care, able to question what we were doing and understand why we were doing that, to improve their own basis of knowledge, and that in turn helped us get our magnet ranking as one of the few hospitals in the country with that level of nursing excellence. We have other members of a multidisciplinary team that round with us every day, not just the bedside nurse, but our PharmD staff and our pharmacy residents, our respiratory therapist, our dietitian, our care management, our social worker. The idea has really been to give the patient a full 360-degree view, where every single person in that team is actively participating in the evaluation and care decision. And the resident integrates as part of that team, where obviously in their first year they're really in a learning mode and just trying to get a handle on things. It's our expectation that they will take over progressive leadership of that team that's sort of leading the whole train of individuals around from bed to bed to bed to optimally take care of their patients. The GME Center will effectively be a focal point. It's going to be our home. We can make sure that the Simulation Center provides state-of-the-art training for a broad variety of procedures, medical procedures, surgical procedures, emergency procedures. It's also going to provide a focal point for lectures, a resource for the residents to use, as well as for the community to use.
I'm big into efficiency. Having dedicated facilities will really help with our efficiency. Repeatability and process is important, certainly in the medical world and elsewhere as well. So having a dedicated facility that has the right rooms, that has the right, everything is purpose-built for this. So we're not repurposing anything. Everything is designed precisely for what we need.
The community was excited. The community jumped on board the minute they heard that they were coming. They started building apartments, they started building houses, they started building restaurants, and they were just very excited. They just knew that it was going to be a good thing for St. Rita's and Lima community, and they wanted to be a part of it.
This is unlike any other place I've ever worked. The sense of community, the sense of belonging, the sense of welcoming, the sense that you are really doing something to benefit people and the community here, and that you're welcomed sort of into the fold of St. Rita's itself. It gives me a warm feeling every day that I walk in the door.
So the biggest thing of being part of a big institution is that I can always reach out and have the necessary resources available, and we can always find solutions to any problems that arise.
I think our mission speaks volumes, and there's not too many places in the world anymore that can actually talk about God in public. We have prayer service in our lobby, and not too many places can do that, and that's very important to me. And I just think that's awesome. I just can't imagine working somewhere without that.
We hope to be able to retain some of our best and our brightest trainees here, either directly after training or if they go away and get subspecialty training in a whole variety of medical specialties and come back. We hope to impress them enough with the community that this will provide us an ongoing, self-perpetuating source of good medical care for our own community of Lima and the surrounding communities for untold decades to come. By having a teaching program in town and keeping some of those individuals in the community will help provide that medical care. Our residents will help ensure that not only will we have medical care in town for as long as we can see into the future, but to make sure that that care is at the cutting edge, that it is state of the art, that it is the best it can conceivably be.